session 3. So in our previous episode, we've talked about the diet and movement, which are the things people often neglect. So now we're shifting to deliberate harmful choices, which is the smoking and drinking too much alcohol. So Richard, so these are the heavy hitters. We've known that they are bad for decades. But I think people have become a bit numb to the warning. So can you give us the raw facts about it?
You're right, Micah. Yeah. People get warning fatigue, but the numbers are shocking. The tobacco use is still the single most preventable cause of death globally. When you light a cigarette, you're not just inhaling smoke. Remember that. You are starting a chemical attack on your body.
That sounds intense, Richard.
Yes. Cigarette smokes has over 7,000 chemical compounds. At least 69 of these are confirmed carcinogens, chemicals that can mutate your DNA. So we're talking things like arsenic, formaldehyde, and benzene.
And it's not just the lungs. Many people think smoking only causes lung cancer, but it affects skin, wound healing, and your overall health.
So what about the blood? I've heard that carbon monoxide is dangerous.
Yes, carbon monoxide in smoke has higher affinity for hemoglobin than oxygen. That means it is still the seat where oxygen should be sitting in your blood. Your heart has to work harder just to deliver oxygen to your organs.
Meanwhile, the tar in cigarette coats the tiny hair in your lungs called cilia, which normally clean out mucus and toxins. When they stop working, people can get the COPD, means chronic obstructive pulmonary disease. You're basically trapping toxin inside your own lungs.
So it's not just smoking a bad habit. So it's a full body attack.
Yes.
So you mentioned earlier that smoking stops up the arteries. How does that lead to heart attacks?
Think of the inner lining of your blood vessels, called the endothelium. Okay, like a smooth non-stick pan. Smoking turns that pan into sandpaper.
So that sounds painful, Richard.
It's not literally painful, but smoking damages the vessels. It causes like oxidative stress and tiny nicks along the walls, okay, which also triggers inflammation.
And that's where the cholesterol from session 1 comes in.
Exactly, Genmar. The bad LDL cholesterol sticks to those nicks, and this speeds up atherosclerosis, which is the hardening and narrowing of your arteries.
So what about the blood clots?
Smoking makes your blood thicker, which raises the risk of clots. If a clot forms in a narrowed coronary artery, so that's a heart attack.
So it's like a vascular tax. You're paying with your circulation.
And heavy alcohol use does the same thing?
Yes, drinking too much alcohol can also stiffen your blood vessels and increase heart attacks.
Correct.
Or heart risk.
So the combination of smoking and heavy drinking really takes a toll on the whole cardiovascular system.
Exactly.
So let's talk about alcohol, Janmar. People often say drink in moderation, but that is confusing. Why alcohol is risky?
Some old studies said alcohol could be good for health, but that's not true. Alcohol is officially a cancer-causing substance like tobacco or asbestos.
So even a little alcohol can be dangerous?
Yes, drinking alcohol can increase the risk of cancer like mouth cancer, throat cancer, liver cancer, and also the breast cancer.
when your body breaks down alcohol, it makes a chemical called acetaldehyde. Okay? This is toxic and can damage your cells. And that's why alcohol is linked to cancer.
And also, drinking too much can also hurt the heart. The heart can give weak and stretch, and it will not pump blood well. It can also scar your liver permanently, which is called cirrhosis.
So what about the responsible drinking?
Even for adults, the limits are small. But here's the important thing. Minors should never drink. For adults, alcohol can still cause serious health problem if used too much.
Got it. So the safest choice is, especially for young people, is not to drink at all.
Exactly, Micah. Avoiding alcohol and smoking is one of the best way to keep your heart, liver, and body healthy.
So this can feel heavy for someone who has smoked for years or drinks to cope with stress. So is it too late to turn things around?
It will never be late. The body is an amazing healing machine if you stop the daily damage. For smoking, changes start within 20 minutes. Your heart rate and blood pressure begin to drop. Within 12 hours, the carbon monoxide in your blood goes back to normal.
Yes, within 1 year of quitting, the risk of heart attack is drops by half. Within 15 years, the risk of heart disease is almost the same to someone who never smoked. Remember that. The lungs take longer to heal, but the heart and the vessels take improve quickly.
So what's the best choice or advice for someone who smokes or drinks?
The most important thing is to stop completely and get support from family, friends, or counselor. You don't need any special tool, just a strong decision and help from the people you trust.
Yes, even taking a break from alcohol for a few weeks can help your liver recover and improve your sleep and mood.
So the message is clear, everyone. So minors should never drink or smoke. And every day you choose not to. So you are protecting your health and your future.
It's one of the most powerful choices you can make. It's hard, but the benefits are huge. Your body starts preparing itself almost immediately.
So well said, Janmar. So thank you both. So join us for our final session where we tackle the invisible risk factor, which is the chronic stress.